We all have understood that heart failure with preserved ejection fraction is a condition where the ejection fraction is equal to or more than 50%. This is a new entity, so the therapies are not yet evolved. Contrary to heart failure with low ejection fraction, where there are multiple therapeutic options, the therapies in heart failure with preserved ejection fraction are limited. So that doesn't need us to lose heart. In the last 2 years, we have 2 new groups of drugs which are found to be useful in heart failure with preserved ejection fraction. But before we go to understand about those new drugs which have been useful in normal ejection fraction or ejection fraction more than 50%, let us understand what are the fundamentals of targeting this preserved ejection fraction. Number 1 is control of high blood pressure and keeping it less than 130/80, control of diabetes. Number 3 is control of dyslipidemia or high cholesterol levels. Number 4 is if there are any blocks in the heart vessels, removal of those blocks. And the 5th is daily physical activity. It has been shown that people with normal ejection fraction and heart failure, if they do daily physical activity, which includes aerobic activity like walking, cycling, gym, swimming, running, plus resistance training like yoga or weightlifting, they are definitely going to help this patient of preserved ejection fraction. In addition, the new drugs which have come up and which have been showing to have promise in the last 2 years are, last year we have one drug called the SGLT2 inhibitor, that is sodium glucose cotransporter inhibitors. So this group of drugs are useful for the treatment of diabetes, for the treatment of heart failure with low ejection fraction, and now for those with preserved ejection fraction. The common examples what we have in our country are empagliflozin and dapagliflozin. They are available, but we have possibly will be having a new drug called sotagliflozin, which is already approved in the US for the treatment of heart failure with preserved ejection fraction. Now what did happen new in 2024? In 2024, another new group of drugs that is called as the GLP-1 receptor agonist, that is glucagon-like peptide 1 receptor agonist. This group of drug, the medicine is called semaglutide, has been found to be useful in the treatment of heart failure with preserved ejection fraction. So what is the semaglutide? Semaglutide is a drug which is predominantly identified for the control of diabetes, but it has been found to be useful as a weight loss drug and it has taken the world over storm. But now it has also been useful in the treatment of preserved ejection fraction. So we have got 2 new groups of drugs, SGLT2 inhibitors and GLP-1 receptor agonists. Over and above that, we have to understand that the therapies are further evolving, like the pacing therapies and cardio MEMS, that is close monitoring of heart failure so that they do not get worse, and if there is any change in the internal parameters of the body, targeting with the drug dose modification has also been shown to be useful in patients with heart failure with preserved ejection fraction. So let me summarize. Treatment of heart failure with preserved ejection fraction is challenging. The main thing is control of the risk factors, daily physical activity, and 2 new groups of drugs and close monitoring. These complete the entire spectrum of therapies for the management of heart failure with preserved ejection fraction.